All right, I have a message that is being live streamed. You're ready to go?
I just got confirmation. The floor is yours, Mr. Chair.
Oh, perfect. Awesome. Well, good afternoon, everyone. It's December 11th. It is 3:04 p.m. This is the Children's Services Council of Leon County Strategic Planning Work Group meeting. We will go ahead and call to order. If we could go ahead and have a roll call.
Miss Richards, Commissioner Cummings, Mr. Johnson,
Here.
Chair Jones,
He's here.
Superintendent Hannah, I apologize for skipping you,
No, it's okay. I'm here.
and Mr. Watts, Chair of this committee.
Here. And for the record, do want to recognize that Chair, Council Member Cummings will be joining us late, a little bit later. And we did have from Ms. Richards where there was a conflict, and so she will not be able to attend. Other than that, we will dive right in. And so we have our agenda. All in favor of the agenda that was sent out? We need an approval of the agenda.
I move approval.
Second.
All right, moved in second. So moved. So all in favor? Aye.
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 Perfect. All right. Well, we will go ahead and dive right in. So today we have a few topics, hoping that we will actually accomplish, if appropriate, and if not, we do have on the books another proposed meeting. But we're going to discuss today the youth and success draft goal review, and then from there go into our family well-being deep dive, and then have some hopefully proposed SMART goals for the family well-being. So you know that we last left off the last meeting where there were some homework and assignments to help us narrow down, zero in on some SMART goals for the youth and success. And so with that and those assignments, I think I'll turn it over to Sika and Holly. Do you guys want to go ahead and start presenting, and then we can maybe make a decision where we land on for that SMART goal?
Yes, thank you, Vice Chair Watts. So as we are moving today, we would like to look at our agenda and do the following. Take about 15 to 20 minutes to finalize our youth success draft goal. We could take a little bit longer given our time limit if we need to. And then about 45 minutes to an hour with our family well-being deep dive. If we're able to do that, that should leave us a little time to talk about capacity building goals, expanding on that and exploring that for about 30 minutes, which should get us to about 4:30. And that gives us some time to do some closeout. If it turns out that our discussion goes a little bit longer, we will try and get that last meeting on the books, but it's going to be during a time when we know people are trying to do the holiday. So with that, Holly has started sharing the screen. And we are going to revisit our youth success draft goals that we came up with during the last meeting. Next slide. So these are the SMART goals. Again, these are drafts that we just prepared as a starting place for you with possible objectives. And so one of those goals, and it looks like we have one on each slide. So we're going to start here with the first one that was on the list from last week, because I think that there was consensus that this was definitely one of the goals that we wanted to maintain. And that's increasing the number of Leon County third graders in Title I schools, reading on grade level by 5 percentage points by 2030, using 2025 as the baseline. So per your request, we added the measurement indicator that we would use, the percentage of third grade students in Title I schools achieving FAST ELA Unified Scale Score of 485 or higher, and that would be tracking the PM3 proficiency benchmarks. This comes from what Department of Education uses to determine third grade reading level. And so when we think about the objectives and the tactics that would be possibilities for this particular goal, We would want to strengthen our early literacy supports across K through 3, and that's coordinating with the schools, out of school time providers, our family resource centers, and expanding literacy-rich environments. I will also add to this that Leon County is not a grade level reading county, so we've got grade level reading, the campaign for grade level reading that is statewide. We do not have that in Leon County yet. We worked on it, and I will tell you, Brooke kind of led that for us. And in addition to Brooke having a gazillion jobs, we just determined that was not the right time to do that. But I think that we could look at really establishing Leon County as a grade level reading county. Then we would look at reducing the barriers to daily attendance and engagement. So while we may not focus directly on attendance, because that was a point of discussion last time, we would look at partnering with
All right, we lost
barriers so
Oh,
that our
there she
kids are
is.
attending school.
we lost you for a moment in time. So I last heard around you were clarifying how you were weaving in the attendance component to that second objective versus that larger one. That's where we left off at. Okay.
Yes, can you hear me now?
Yes.
Yeah, you froze.
Yeah, something's going on with this internet connection. So I'm gonna try and talk fast. So yes, that was the last thing I said there. And then you can see there's some of the other things we would do regarding reducing barriers and then strengthening caregiver capacity to support early literacy. So looking at things like GOMO literacy, New Worlds reading, all of the different strategies that engage the 2-gen approach with the families and the child to increase that literacy as well. And each of those have measurements that would come with it so that it feeds into the larger measurement that we would use to determine how our students are doing as far as being reading on grade level in the 3rd grade. So with that, I'll pass it back to you, Chair Watts, so that we can take some time to discuss this and see if this is where you want to land.
Oh, I appreciate that. I quickly want to say I do like this one with the actual, I think some of the feedback from the last meeting and some of the members were wanting to validate the 5 percentage points. And so maybe just walk us through the validation around that measurement.
So when we look at where the state would like for us to be, which of course, right off the top of my head, because I don't have it in front of me, what that goal is, but I bet Holly can pull it up right quick. While we may not be able to hit all of that at one time period, we want to break it up into pieces, given our staff capacity, given funding. Keep in mind, we've got this property tax thing kind of going on. And so 5 percentage points should get us moving in the right direction by that time. The beauty of it is if it looks like we're hitting that 5 percentage points, let's say by 2028, we have the ability to be dynamic and then change or augment that goal so that we can move even further. So again, while these are static in terms of approval, the plan itself is dynamic and will be responsive to the data that comes back to us as we are doing the measurements.
Okay, and I'll just get the rest of my thoughts out and open it up. I think it's very I think it's a great idea. I think it was really smart to weave in the second bullet, the reduce barriers to daily attendance there to tie it to this SMART goal. I think that's reasonable, and I think that gives some wiggle room to come up with options or ideas to help move that. So I love that being tied to this. The third bullet, let me ask you this: do we have to have 3 objectives? Because I don't know. I no.
No, we don't have
I
to
like
have 3
I like the
objectives.
first 2. I do. I like the first 2. I will open up to the group. What feedback or thoughts do you have on this particular SMART goal?
Well, again, I mean, I'm in theory, I'm fine with it, and I would love to see it happen. I just haven't dug enough in on where we are currently. I know we have seen a lot more success in our Title I schools than this past year than we have in the past. I think 5 percentage points, just leaving it there for now. And I mean, I think it's realistic. I don't think it's too um, sort of,
Aggressive.
yeah, too aggressive. Uh, but I would also like to talk to my people that do this every day
Mhm.
to get their input. And I just haven't had a chance to do that since our last meeting.
All right, thank you for that. Oh yes, go ahead, Councilmember Johnson.
Yeah, I still struggle a little bit thinking about this metric and the role of the CSC's investment to be able to move that metric by 5 percentage points. In my mind, the lion's share of that effort, um, it sits in the schools, and we can make some investments that may push it along, but this is where we have to understand what the community investment is in these Title I schools that may be necessary to move that metric. It's certainly not what, we can say as a council that we've helped with this out of school supports that were given, but uh, let me try to phrase it a different way. Do we have examples from different school districts or even any of our existing schools where they've made significant improvements in this and what the critical levers are to get them there? And does that comport with the tactics that we've identified?
I want to open it up. I see, before I answer, I see School Board Member Jones. Mr. Watts has unmuted, so I think this would be a good place for him to
Yes,
jump in.
ma'am. Well, what I thought at our last conversation that we were looking forward to the superintendent engaging with his staff to bring back some expertise regarding particularly issues regarding attendance and engagement. We already talking at great length about what we know are the supports early on through both Head Start, early learning, and other activities in terms of how they prepare us for not only kindergarten readiness, but for the state testing that they do at the third grade. So I don't know to what extent we are looking, what additional information we need in terms of the importance of early learning. We've heard that testimony at great length. I don't know what else Mr. Johnson wants. Supports in those areas are critical, but I don't know. But as it relates to attendance, I know that the superintendent was supposed to bring us back some expertise from the team. Well, so, and it was in this category, and I think potentially another category that we went to after early learning. Because we wanted to know that these percentages were attainable, as I thought was the conversation.
Right. Are they
Eh,
obtainable? Are they obtainable by either, are they obtainable by things that we as the council can do? Do we know if we pour more money into uh, any of these programs that they will directly contribute to an increase in the reading on grade level? I
I
know
So,
it's important, but do they correlate directly so that if an investment in X yields the outcome of Y and Y is equal to 5 percentage points by 2030?
I think that um so to one point to Chair Jones, yes. So Superintendent Hannah is going to do a little bit of a deeper dive, connect with us, Sika and team to make sure that that 5 percentage points, right, that we have there is a valid number, good number, or X, Y, and Z. Um, but to Councilmember Johnson's point, and this came up before, I I I think it's a wording perhaps thing. What I hear from him is that ultimately, if we how can we say we CSC increased the grade level reading scores by 5% just based on our efforts, not not contribute what other efforts are already existing through other programs or efforts that are just being handled by the school by itself. This is how it came up to the one point where like, do we just want to focus in on one school? Is that a way to maybe narrow down like, yes, our efforts in X, Y, and Z to this one school, yes, but I think it's a wording. I I think if we changed,
Well,
go ahead. Okay, yeah, go ahead.
Mr. Chair, if I can jump in.
Yeah.
So the needles that we're trying to move in our community are very large, to Mr. Johnson's point. The $9 or so million that we collect every year alone is not going to do it for sure. And so as we look at the goal, we would be looking at so I think last time we talked about removing select Title I schools and just saying Title I schools. That being said, we still have to do it in an incremental manner. We don't have the ability to just deploy something out at every Title I school without having a stair-stepped approach, number one. And then when we are looking at that school, we are looking at what supports are already going on in that school to determine where that gap is and where we want to fill that gap to move that school or move those students in a direction. We will, to your point, not be able to deploy everywhere all at once, but we can be focused in our approach, starting maybe at one Title I school. As we get that school on board, we are able to identify some other sources, then we can move to another Title I school. So it is a concerted effort, but part of what we do before we suggest an investment to you is we look at the landscape of what is going on in that area where we'd like for you to contemplate investing and be very clear about the part that we play in that, working in concert with whatever other supports are going on in that school.
So do you have let me put it like this. Right now we have grade level by 5 percentage points by 2030, using 2025 as the baseline. So let's say 2030 rolls around and grading scores rose 7 percentage points. You guys have a formula. We'll have
We
a
will
formula.
know what part we played in that. Now, would we have done it all by ourselves? No, but we will have data to show that our investments in said school, in said classroom, in this area moved this school, these students from here to here. So we are able to show our part in that achievement.
And could it possibly be
Go
different
ahead, I'm
parts
sorry.
in different Title I schools?
Say again.
It could be different areas of emphasis in different Title I schools based uniquely on where they're positioned and where their gaps are.
Exactly.
I think it's important to document that uh, as we get
Because
deeper.
if a school, if we say we want, I'm just throwing this out here. If we say we want you guys to fund New Worlds Reading and we want you to fund it, I'm just going to say at Pineview, and then we say we're going to fund it at Pineview, at Oak Ridge. Well, what we see is that that's not really the need at Oak Ridge. What Oak Ridge needs is this, because New Worlds Reading is already there. Okay, so then we would look at putting whatever need is there. So to your point, yes, we're not going to blanketly deploy across any school if there's not a documented need that that's what is needed at that school. So you could have 3 different programs and all 3 of them are not operating in your school. They're operating in the schools where they are needed.
Okay, I'm good with this, at least as one participant, subject to Superintendent Hannah getting uh, validation from his people.
Any any other comments? I saw Superintendent Hannah, your box was lighting up. I wasn't sure if you were off mute. Wanted to say something.
No, I apologize, guys. I think I'm unprepared for this conversation. I mean, I would love to get our folks involved a little bit more on what things they think that the Children's Services Council could do outside of what we're doing to impact this objective. And I'm just not prepared. I'm just not prepared to speak to it, to be honest with you. And the
And
five,
Mr. Hannah, I think that that's okay because once we get the draft goals, it's our job as a team to go back and speak with you and who you tell us at the school district we need to, with whom we need to collaborate so that we are refining what these tactics are, refining and ensuring that that's a good percentage rate. So really, I don't want, and Chair Watts, you can tell me if I'm off base. I don't want us to get too into the weeds of all the specifics, but rather we know this is where we want to impact. These objectives make sense. And then we as a team will go back and refine them so that it is clear this one is good to go. It's good to go and it's ready to be presented. I hope that makes sense what I'm saying.
I think it makes sense. I want to say that the current draft you have here, unless something radically, right, based on you guys connecting with Superintendent Hannah, changes, then I would say we would need to bring it back. Like if right?
Yeah.
So if we're okay with this and these objectives and tactics are just proposals based upon, right, just to give an idea of what it could look like. So really right now we're just trying to make a slight decision on this particular draft goal. Are we even in the ballpark? And high level, are we okay with this one based upon what additional information comes back from Superintendent Hannah and CSC staff?
I am, unless y'all can think of another measure outside of the school district, that accomplishes the same thing. I mean, what other types of things would we do to measure youth success? First, what is the definition of youth? I don't know. I mean, I think there are a lot of things that play into youth success. Them third grade reading is certainly shown to be very critical component of them showing future successes and graduation rates and post-secondary attainment. But are there other things that we can think of that, Sika, maybe you can have some other ideas?
Well, we have two more goals for this section. This was just the first one.
More
If you
proposals.
remember, we had 4 from last time, and so we narrowed that down to 3. So if you are good with this, Chair Watts, we can move to the next one. Also, once we finish this process, we will put all this in a document, send it to every member of the committee for you to look at, dive in, questions, give us feedback so that we can come back with that final draft.
All right. We can move towards, I just want to add one more about that last one with the third grade reading. I think part of our strategy was we did agree on a previous goal, which was around the kindergarten readiness. And we thought that the third grade could help, just kind of tie into that. So that's where we were kind of landing on that one. Okay.
Right, it would
okay.
dovetail. It made sense from the kindergarten readiness perspective, and now we go to
Okay. All right. Well, all right. What's your next one?
All right. So our next one under this area is increase the percentage of Leon County youth, specifically middle and high school students, demonstrating strong protective factors and positive mental health by 10% by 2030, while also reducing non-fatal self-harm behaviors and teen suicide rates. If you remember, and I think Holly can pull it up, she can show you the self-harm rates that currently we are reviewing, and how that plays into the strong protective factors for youth. So we'd be looking at 3 possible measurements: the protective factors and resiliency screening, the annual rate of emergency department visits for self-harm among youth aged 12 to 17, and then a 5-year rolling average of suicide rate among youths aged 13 to 19. So the strategies or the objectives and tactics we were proposing is to strengthen resilience supports in out-of-school time programs for grades 4 through 8. We are already funding that, but we would strengthen that by working with the providers serving those students to integrate practices for coping skills, emotional well-being, positive peer relationships, connect us with supporting adults. And then the next one would be expanding early identification and navigation supports and screenings, referrals, warm handoff pathways in OST settings, family resource centers to help identify youth experiencing emotional distress and the like. What I will add here before I turn this back over to you, Chair Watts, is that one of our newer council members is Austin Vanderlinden, and she is a licensed clinical social worker with a practice. She is very interested in this particular area and was clear that we should have some sort of focus in this area. And we will meet her at our meeting next week.
I appreciate this information and this proposal. I think this was another one that we were wanting to have some maybe coordination and data validation with Leon schools. Were y'all able to do that on this one?
Well, this one wouldn't, I don't think this one would be Leon Schools. This would be the health department. This would be our provider community that deal with our youth, our out of school time. So I don't know that this one would be Leon County Schools when we're looking at the measurements.
Were there with the 10% by 2030? So was there, I don't know, coordination? I think not Chair Johnson, Councilmember Johnson brought this up before in one meetings, managing entity. Like walk us through who.
So we definitely would be looking at consultation with the managing entity, which is Northwest Florida Health in this area. But to determine 10%, we're looking at the trends. So we're looking at the trend of going down or going up and extrapolating for that what seems reasonable by our end date. So I am going to ask Holly if she would go to, we have a slide that shows that self-harm under youth success. You know how we have the indicators, Holly? Can you pull that up?
I'm attempting to. I think my internet's being a little funny. So if you'll give
Maybe
me
maybe it's something in the water.
I was trying, I've
perhaps,
been trying to press like let's see if this works.
I want to go ahead and
Okay.
recognize Chair Councilmember Cummings has joined the meeting.
Did that flip it?
There we go.
Okay. So these were the most recent rates. We have been tracking this since our original needs assessment. The self-harm, it's information that comes directly from the hospitals and working with the Department of Health on this information. It has to do with non-fatal hospitalizations that resulted from self-harm, and they provide that data to us by age cohorts, and then as well as the teen suicide rate. So that information is there in the health department. I know the managing entity is involved a little bit with this work, but it's more the health department that we have been having communications with, as well as some of the youth development programs that we've had those original conversations with all of the ones that we've promoted here. It's viewing our role as the catalyst for change in collaboration with our community partners. So all of the strategies will talk about the community partners that are engaged in this space. But that's the other thing is that Sika asked to do was to remove the very specifics of how we might measure something, because oftentimes it's rolling rates when we're looking at the community level piece of this. So I think the question that you're asking here is a 10%, is that something that we think that we can do in 5 years? And this particular one, as long as you're not honing in on one particular zip code, because what they said is that this is across, what in our conversations with the Department of Health, is that it's across the entire community and that it's not isolated in particular areas. However, there is a heavy correlation to those families living in poverty. So that if you wanted to try to hone in, you could. But in this particular case, what we're seeing in those conversations, and we'll have the expertise joining us very soon on the council, is that the impact of COVID, social media, and the increase in young people experiencing anxiety, probably to do with the way things are being advertised now through social media, might be playing the biggest role. But we are having those conversations with the experts in the community.
Thank you, Holly. Can you go back to the draft proposal?
Yes, sir.
I'm going to share that, well, I do believe this is important. I do struggle with it. I struggle with it from logistics. Like I'm thinking in my head, this one will be even tougher, um, in my mind to measure, our impact. I totally get the Leon County School one. Like that one seems like an easy fix to me. That seems, but this one seems really challenging to me. Now, I mean, I'll open up to the group, but do we even have to have, we don't have to have now. I know that answer already, but I struggle with this one. Not saying that it's not important. I struggle with how we,
So what I can add is that for any of our funded programs, we are looking at the children and youth that participate in our funded programs, because we start at a point with those children and youth, and then we measure in the middle and we measure along the end. So any funding that we do, we are looking at those children who are in our programs. It is not practice. I'm trying to see the best way to say this. We do not look at the funding that we provide, and I mean across all the CSCs, as kind of a control, and then those that get the service. So it's not a scientific where you've got the control group that you give the placebo, right? You give the placebo, and then you have the group that you give the real drug to. We don't do that, but we can look at those who participate in our programs, where they start and then where they end. And ideally, if they're ending better than they start, then that's going to be an increase in the number. And that's going to be the case with any of the programs that we fund.
let me ask a follow-up to that, and then I'll let it go. In my mind, I'm almost thinking, why wouldn't we entertain, okay, prior to this, says middle and high school. Why wouldn't we, if we have an assessment of what these triggers are for the middle and high school students who are engaged in these behaviors, maybe our better strategy is to get before that. So
Say that
before,
again, you went out. I missed
maybe
that.
our strategy is to get before the middle and high school. If we have an assessment around what these triggers are for these folks that are in middle and high school, maybe our strategy is how we approach the youth before they even get to middle and high school around whatever coping or X, Y. Did you get what I'm saying?
Yes.
I see the superintendent leaning in. Okay. Yes. So that is absolutely a strategy. So instead of looking at when they enter, let's say 6th grade middle school and then 9th grade high school, maybe we're looking at 4th and 5th grade from a point of view and trying to get them in a place that by the time they get to middle school, they've got that stronghold that keeps them motivated and moving. Or we're looking at seventh and eighth grade, we're looking at middle school so that before they get to high school, they have those supports that they need to keep them out of the space of self-harm, self-deprecation, and all of the things that go along with that.
Or even if
Can I
they're
add to
having
that?
those, go ahead.
Mr. Watts, it has to do with when the times is being measured. So to your point and to exactly what Sika just said, the tactics and the activities that we fund target younger individuals so that the impact is felt up in the older individuals. It has to do with the survey that is conducted through the youth behaviors survey with the Department of Health and the census. It's not captured at a younger age. So we have to design our funding opportunities to target the later elementary, upper elementary, and middle school to see the impact in high school.
Mm-hmm.
All right. What are the comments or thoughts we have from the group?
Chair Watts, I apologize for being late. So I'm just at a listening mode now. I've enjoyed the conversation so far, but it seems like we're looking for a baseline. If we look at this youth success, middle and high school, is that, was that your point, Chair Watts?
Yes, this is the next draft goal. We don't have to adopt this one. This is a second proposal that they're producing for us to have a discussion around. And we've had a consistent conversation around how do we actually measure or know that we actually impacted the CSC, any of these numbers, or did not, support any impact. So yes, that's where we're on right now. Do we like this draft proposal? Do we want to save it for another time? Do we want to change it? That's where we're at now. Yes.
Chair Watts, man, so it looks like we're going to be heavily dependent on Superintendent Hanna in the school system, as far as establishing the appropriate, I guess, baseline for measurement, even with our service providers. Am I correct?
So, as explained to me, for our previous draft goal around the third grade reading, that's a yes. This particular one, the CSC team is more so indicating that the health department's data and other providers more so drive our baseline of where we start or move this one. While
Oh,
we,
okay.
yep, okay.
Okay, thank
And
you. And I
remember,
apologize for being late. I hate to ask questions that's probably already been answered. Okay, I see this one. Thank you.
Yep, no
and
problem.
remember now we want to let's try to keep it at a high enough level and let us as the staff dig into the weeds of how we're going to measure
Uh,
the intricacies of the strategy. So we want you all to stay kind of at that high level of what you'd like to impact.
Awesome. Okay, I like that.
I
So
think I
if
was
there are no more
tracking,
comments, go ahead. I'm sorry.
I think I was tracking where Chair Watts was on this one. If there's a large chunk of the county where we aren't making investments as a council, it's hard for me to look at a goal and go, we didn't make any investments, but things improved somewhere outside of our investments, in our investment geographic area, like we'd previously identified Title I schools for the goal. That's where we're making the bulk of our OST program investments and some of these things for school-aged youth, with the hopes that by the time they get up to these age cohorts that we're measuring, we will have provided them with some skill sets to help reduce ER visits and self-harm and suicide rates. but we'd almost need to baseline specifically where we as a council are making investments. In my mind.
And this particular data point is not provided at the zip code level or the census tract level. And when we dove into that a little bit deeper with some of the providers, I mean, the hospital could provide it based on some information that they have, but that's where they said that it was not exclusive to, while there is a correlation of higher incidents occurring for families living in poverty, and that's where, when we do our targeted investments in terms of our 5 priority zip codes, it is a correlation directly with families living in poverty. We could maybe consider, we could look at trying to get that information to establish the baseline. I think ultimately what we're saying is we have one of the highest rates in the state of Florida here in Leon County as it relates to this. And is this something that the council wants to dive into deeper? And if it is, then we can tweak those goal statements to, if we want to be them, if we want to have them more targeted so that we know that percentage change or in these zip codes or however we have. Currently, that data at the zip code level is not available.
And you don't have to accept this one. We can go to the third one and we can come back. So it doesn't have to be this one. This was just one of the second options.
Any
So,
other?
yeah,
Go
let me,
ahead.
real quick. I'm really confused about how this is measured, to be honest with you. I don't know 10% of what that this is measured by the health department, and the previous screen said X number of 100,000. We don't even have 100,000 middle and high school kids in Leon County. So, and I will say, another component of our school district has been this thing called threat. We have to do all these threat assessments. As an example, we've done threat of harm to others and self-harm. We've done over 400 suicide risk assessments with kids. So our numbers look really high, but we also are monitoring all of their devices. And so those interventions and the number of Baker Acts that we've had for kids intervening before something may occur is much higher now than it was 5 years ago or prior to COVID, because we are intervening so much more and in situations where they're online and posting things. And I mean, it's a huge issue for us because it's taken a lot of time and an effort and energy for us to do all these threat assessments. But those numbers may actually go up if you're looking at non-fatal self-harm behaviors. Would include kids that are being Baker acted and other, I would imagine. So I would be careful about increasing the percentage of demonstrating strong. I don't know. I just don't understand that metric, to be honest with you. And yeah, and it's been a minute. Thank God. Well, I don't want to say anything about suicide, but yeah,
I think to your point, Superintendent, the idea was to possibly layer a couple of measurement indicators together, because this is not so black and white. This, like, grade level reading has a measure, it's reported across the state. Kindergarten readiness, same thing. But we know a lot goes into that. So when we're thinking about how we might measure this, the idea is to combine multiple, using like the data that you're collecting in the middle and high schools with those threat assessments. And there are very similar tools being utilized across the state, in districts across the state, but I know that they're not uniform. But then also pairing that with some of that universal reporting that has to come in from the health department, and creating a layered baseline, if you will, or a layered metrics that would include the threat assessment. And we just kind of put protective factors and resiliency up here as kind of a placeholder for what that would look like. So it's It's not either or, it's both and.
Okay.
Um,
Ultimately,
that was,
Mr.
yeah,
Chair, let me jump in.
okay.
Ultimately, you could decide this is a little too convoluted. While we know it's important, it could be that this particular goal is just a little too convoluted for us to manage at this point. So we could put a pin in this one, move to the next one, and then if you guys decide you want to come back and you really are feeling strong about this, we can dive into it deeper. I just don't want us getting too deep in and really we might just say this is just a little much than we can handle right now.
That's a great point. And man, I didn't even consider the Baker Acts. So thank you, Superintendent, for bringing that up. That does add a whole complexity to
Dynamic.
this goal. Um, because not some of those Baker Acts are driven by mental health
Mhm.
diagnosis and barriers that these goals are not, and these are some of your heavy utilizers, multiple Baker Acts, so they're trying to manage other things. I say that we put a pin in this one, we revisit it, but build it out better to where it makes more sense of how we measure it. And with that new member that you say is coming on, I say we that's my opinion on that one. But does anyone have any other thoughts on this, holding off on proposing this as a particular SMART goal right now?
Chair Watts, I tend to agree with you. I think it's lofty. I commend staff for looking at it. It is a problem. It is a major issue. Um, Superintendent Hannah knows firsthand, but it's global, it's wide range, there's so many different variables. So I agree with you. Let's put a pin in it and move on. But I commend the executive director and Holly and those for the way they have, structured it and placed it before us. But I think we need to think about it a little bit more.
Any other thoughts before we move to the next proposal that the team has drafted for us? All right, next slide, guys. Thank you.
Okay, so this would be the last proposed goal for this area, and it's increased the percentage of young adults that those ages in Leon County who are either employed or enrolled in post-secondary education or training by about 10%, 2030. So the measurement indicators would be the U.S. Census American Community Survey, the one-year estimates tracking employment status, post-secondary enrollment, and workforce training participation. So some of our objectives and tactics would include expanding work-based learning and career, exploration opportunities. And so we'd be partnering with the chambers in our county and the city of Tallahassee, Leon County government. We'd increase internships, apprenticeships, shadowing, looking at possibly putting what are called career centers in some of our public schools. That has started, but there needs to be some expansion of that, and then including our partnership or expanding our partnership with Worlds of Work. And then last is improve the post-secondary enrollment and credential attainment. So working with Tallahassee State College, Lively, Career Source, the school district, College Access Network, all of that to identify partnerships to support navigation, financial aid assistance, and enrollment in high demand training and credential programs. As you're aware, we've kind of started down this road with our summer youth internship program, which has gotten huge success. We are already partners with Worlds of Work, but there is opportunity to expand on that to ensure that we are getting as many kids as possible into that opportunity. Another thing I will say, and Superintendent Hannah, you can tell me if I'm totally out of place with this, but I was listening to the agenda review for the school board, and I was particularly keyed in on, I believe it was Principal Burgess, and I can't think of who that was with him, talking about the absentee rate and a partnership that we really need to look at with our business community to collaborate on school attendance and the possibilities of working versus working over school attendance. So maybe that is something we can even pull into this and in a roundabout sort of way, help to impact the absenteeism while partnering with the businesses to do some incentivization around school attendance. So if I'm out of place, you can tell me I'm out of place, but that hit me like a ton of bricks when I heard you guys talking about that. And I immediately thought about our youth internship program and the opportunities with Worlds of Work to have those conversations with our local businesses so that we can work to incentivize them to incentivize the students to attend school and work versus either or.
Yeah, no, you're right on it. You're on the right track. And, we're still trying to solve this post-COVID attendance issue, to figure out why is it that kids are missing more school now than they were before? And I think a lot of it goes to a lot more people are working from home, a lot more parents are working from home. I don't know, but we're trying to do anything we can to to address this issue, because if they're obviously not in school, they're not learning. So, but it's a national issue. It's not just a local or a statewide issue.
Any other thoughts on this proposed SMART goal?
It's probably a question that goes to the superintendent, but we're jumping from kindergarten readiness to third grade reading, and now we've jumped all the way out to post-secondary employment. Is there some sort of a SMART goal around increasing high school graduation rates that gets this one, that comes before this one, or not?
Yeah, and we had a presentation on high school graduation rates the other day. We're doing better. We've experienced a slight dip over the last several years. We're starting to bounce back some. Another key indicator of student success is ninth grade retainment. To be honest with you, the kids that are retained in ninth grade are less likely to graduate from high school. So that might be one that's kind of in the middle of we go from 5-year-olds to third graders to ninth grade retention rates to then something, graduation rates or something like this. I just can tell you, kids that are retained in the third grade in the ninth grade really struggle to graduate. And those are the ones that we are really concerned about as they transition from middle school to high school. That first year of high school is critically important. So that might want to, let me again get some feedback from my folks on that number and what our ninth grade retention rate looks like now, and then come back to the group with some more information.
If I may, Superintendent Hannah, the reason why and to Councilmember Johnson's, the reason why you don't see it in here is that high school graduation rates were not flagged as an area of concern or need in the needs assessment that when we had originally done it. And that's not to say it's not important. It's just to say that Leon County Schools has traditionally done pretty good. And to Superintendent's point, saying like, yes, there's been this slight dip, but in comparison to the rest of the state, like it's not one of those areas that Leon County has struggled with. It was the results of the needs assessment. If that's changed and we need to add that in as a focus for the CSC, then by all means that makes sense. But that's the reason why you don't see it here, as it wasn't an area that got flagged by our by QQ research as an area that we should focus on.
So
That
to
being
that,
said, if I may, Chair, and then I'm gonna shut up, I promise. That being said, considering that when we're talking about career exploration and that work and apprenticeship, right around that ninth grade is where we're trying to get them engaged. So your point, I think, feeds right into this as we are working to ensure that our ninth graders are staying in, that they're being retained, that we are showing them career path, all of the things to better increase their graduation rate. So I think that's something that could be built in if this is a direction in which you all want to go, in consultation with your team there. Because I did not realize that ninth grade retainment directly, yeah.
So can we, to your point, Sika, so then can we, if you guys coordinate with Superintendent Hannah on what those numbers look like, and it's something that we could, in essence, draft something where it's one of the objective tactics, right?
Absolutely,
Okay.
absolutely.
So, any thoughts from the team on that suggestion? So it would be, we are looking at adopting this as a potential SMART goal, but enhancing the objective or tactics to include things around that specific ninth grade um, information that they're going to coordinate with superintendent. I'll open it up to the group. Do we want to move forward with this draft? Do we want to change this draft? What do we want to do?
Mr. Chair, I like the draft. I think your comments in conjunction with the superintendent and seekers would be spot on. So if we did that, I think overall that's a smart goal. I would accept it.
Any other comments or groups of comments or inquiries? All right. Oh,
So if I can
okay.
summarize.
Summarize.
So we had these three draft possibilities for goals under youth success. If I extrapolate from what I've heard today, you really want to stick with the first one regarding third grade reading level, and then this one with the augmentations that we just discussed. The middle one about mental health, self-harm, reduction, and suicide, we would put a pin in that one and move it to the back and maybe revisit that at another point in the future. Okay. Perfect. Ooh, our timing is perfect, Chair Watts. We're looking good. So now we are looking at family well-being. I am going to turn it over to Holly to provide some of the data points on that. We did send it out last night, and listen, one of my objectives is to get better with getting y'all information out, and I am working on it. But I'm going to turn it over to Holly to go through some of the maps and the information to get to some draft goals that we develop for your consideration.
Thanks, Sika. In the interest of time, I'm only going to share this one because from a data perspective, we've seen the trends, right? That we know our targeted zip codes, that it's more intense there. So we looked at the families living in poverty, and that's what you see here. But if you could take child abuse and neglect, you could take food insecurity, and it's going to look pretty similar at the census tract level from the data that we have been able to extrapolate from the U.S. Census Bureau, as well as from the Florida Department of Children and Families, the Florida Department of Health, our partners with Feeding Florida, and it all looks very similar. So this is not just zip codes, but rather census tracts. I think that this is probably the most detailed version, kind of look at our community. And then if we were to just lay the zip codes on top of it, it starts here and kind of does this L, or this kind of U, this open U, if you will, for really pretty much all of our data indicators. But you can see the other kind of pockets that we have throughout the community. So as we're thinking about family well-being and really all of our goals, what we know is that anything that we're doing, if we're talking about family well-being and pairing it with poverty alleviation, or maybe I shouldn't say it, strengthening families, increasing self-sufficiency, things like that, then that poverty alleviation will hopefully occur. Most of the research that we have that has come out of our needs assessment and our various research partners, as well as the paths that have been laid before us by sister CSCs, continue to show that there is that correlation of poverty. I think that that's kind of just work that we all know. With that, Sika, I'll turn it back over to you. But you could really take food insecurity, child abuse and neglect. It all looks very, very similar.
Mhm. Thank you.
Mr.
Absolutely.
Mr. Chair, before we move on, mine is just so small I can't see it. Can Holly just tell us what the colors mean? I'm trying to see it, but I can't enlarge it.
Sure. So the
With
darker the
poverty level?
color,
I'm sorry.
yes, ma'am. So this particular one is families living below 100% of the poverty level by census tract. This is a rolling 5-year kind of track. I pulled this particular graph from Florida charts. So it just kind of, it's not just a snapshot today, but rather looking at kind of over the last 5 years. We do have this year by year by year and could kind of show where that poverty has increased or decreased. And but when it comes to this particular one, families living in poverty, it's been fairly consistent. So yes, ma'am, the darker means higher concentrations of families living in poverty. And then kind of the lighter going all the way up to the green is where there are less families. In some instances, and you'll kind of see this right here in the middle, because that's the heart of 32304. And we saw this with our FRC work, for example, why we chose Griffin Heights over Frenchtown. It's not that there's not poverty in Frenchtown, it's that there's not families living in poverty because there's not families primarily living in that census tract. So that's why that kind of looks like that. So again, this is families living in poverty, not just general poverty. I hope that answers your question, Commissioner Cummings.
Hold on one second. Yes, ma'am. So all of the different colors shows the concentrations of.
Yes, or that
This
census
is the
tract.
map of the Leon of Tallahassee area.
Yes, ma'am. So like right here, these two dark ones that I'm hovering over, like that's what we know as South City. These two, which is part of 32301. Out here, right? This is Fort Braden, way out here. But it's this entire census tract. But yeah, and so like right here is like around like 32304 is about this. About that. And then this is 32303 with a little bit of crossover into some of these census tracts.
Okay, thank you. Thank you, Mr. Chair.
This is right in line. If you remember every presentation that we do, we show you all these maps, right? We show you these maps. And I talk about the U of Leon County. This is a definite depiction of that U. It is the same area of intensity when it comes to the disparities and some of the challenges that we are seeing in our other areas. And there are about 5 or 6, when you look at the maps, the 5 or 6 areas that we use to determine how the social determinants of health and economy and all of that feed into our family success. When it gets darker, the darker red means that you've got just about all 5, if not 6, 7, and 8 that are in places where they should not be in those areas. So the idea with this draft goal would be, how do we best support families so that they can move toward more sufficiency, toward increased wages, toward better success, supports for their family structure. So when we get to the draft SMART goals, and Holly, how many do we have for this area?
3.
3 possibles. So the first one would be reducing the percentage of families in target zip codes with children living below the federal poverty level by 5% by 2030. And the measurement indicator would be the the ACS family poverty rate for households with children under 18. Now,
Can
let
I,
me start by
can
saying
I make a
this
quick
is a,
proposal?
huh?
Can I make a quick proposal?
Yeah,
Can you read just the three draft? Go through all three of them.
go
Not read
through
the
all
whole
three.
entire thing,
Gotcha.
just the three headers, and then
You guys decide which ones you want to. Okay, let's go to the next one. So the next one is reducing the rate of verified child abuse and neglect cases in targeted zip codes by 10% by 2030. Then the next one would be reducing the percentage of food insecure children in Leon County by 10% by 2030.
right, go back to the first one, and then this is not going to be popular what I'm about to say. I'm just being transparent. The first question is, do we have to have a SMART goal for family well-being right now in general?
So we do fund under family well-being. If you remember, our priority is stable and nurturing families and communities. Then we've got the 4 impact areas, which is enhanced supports for caregivers of at-risk children, safe, decent, affordable housing, and increase in that, um, career pathways for our youth, and food security, increasing food security. So those are the 4 impact areas under that goal. We currently fund under family well-being. So the Family Resource Center falls under family well-being, as well as its family supports. So we've got I'll use Legal Services of North Florida as the example. We are funding them, and they are making huge strides for families that are dealing with any kind of legal issues. So we do fund in this area, and I would recommend we have at least one goal, and one goal I think would be okay.
Um, that's helpful, and the legal aid example is very helpful, and the FRC is also something that was in my mind. I These drafts are thank you. I think I definitely recommend one. And
Yeah, I agree.
And this
and
one's a lot. Is this the one about living in? This is a lofty one, so I'm just going to start by saying this
yeah,
is loaded.
Right.
it's
And
loaded.
so, but
The
we felt like we had to give it to you.
the first two are really like that one right there. I'm just gonna tell you right now, when you guys first sent that, I had tried to do some research on it because I mean we do have data on that, but when you try to do it by zip code, there are so many variables and factors that we typically don't drill it down to the zip code because of all those factors. Like we can absolutely do it by county, and tell you what type of cases are coming in verified, but that zip code, that would be a hard one. And so
Yeah,
I think the
and if
first two
I
are,
may,
go ahead.
the that's why I was using a rolling 3-year average, or proposing a rolling 3-year average for this one, for that particular reason. And again, our sister CSCs, almost every CSC across the state does have some sort of child abuse and neglect goal associated with the work that they do, from the prevention perspective, not the intervention. And that was where the 3-year rolling average came from, of kind of looking at it that way. But to your point, and I think I put verified, because there's a lot of discussions about how you track it. Is it the incident child, or is it just cases in general that you want to do? And then for the cases, so it's not as detailed as it would probably need to be when it comes to the measurement indicator of how we'll actually track it, to your point.
Um, so I don't know how everybody else feels. I'm glad you said that we fund the examples you gave. Because like the third one, like we're in that space, and we could likely, the third draft, we could likely continue with that,
But the food insecure, is that what you're talking? Food
yes,
insecurity? Well, I
yes,
agree. Right.
yeah.
The first and third one.
And how would you, even if you wanted to tackle those first two, since we have the FRCs are, if you will, I think, designed to
Do
move the
this.
needle with all of those, right?
So if I
Um,
may,
okay.
I'm good at interrupting you, Chair. I acknowledge that. The methodology and the model of the FRC is designed to reduce child maltreatment, to reduce the incidences of child maltreatment in the areas surrounding the FRC. And if you remember, that is how CHS proposed locations. They looked at child maltreatment data, verified and reports, and that's how they proposed that in conjunction with our needs assessment. So if we wanted to look at this particular goal about reducing verified child abuse, we could augment it a little bit and make sure that it is in conjunction with where our FRCs are, because it feeds into the goal of the FRC anyway. If we wanted to do that, and I'm not saying that you all will want to do that at this point.
I think there might be an opportunity to draft a SMART goal around the family resource centers, but I don't think we can do it here. I don't think we can do it here and now. I would propose that we focus on the third draft proposal as an option to build out and put a pin in this. But what any other thoughts from the group? What do you guys?
Chair Watts, I agree with you. I think if we had more resource centers, then I think we would have, a good baseline perhaps. But with only two, I think we'll be setting ourselves up for failure as far as statistics is concerned, and as far as the impact of the work that we do. I think the ones that we have are doing a good job, but then when you compare it to the overall areas of need, and just even maybe just overall population of need in the county, I think percentage wise, it wouldn't show up as well. So I think at this stage, we'd be setting ourselves up for failure. Statistically wise, number wise, impact wise.
So understanding what Chair Cummings is saying, Chair Watts, what I will say is I would like, if you would allow us to go back and look at maybe crafting something that is a little more palatable and achievable from you all's perspective when it comes to this goal. What I will say, I'll go back to what Holly said. Almost every CSC, if not every CSC, has some goals surrounding the reduction of child maltreatment. And it's from a preventative standpoint. So I think the fact that we have invested so much in FRCs, and yes, we only have two, but we do have the ability to look at the data that surrounds those two FRCs, and we can see the impact of the FRCs in that surrounding neighborhood from the metrics that they are required to meet in their contract. So what if we went back, looked at those FRC contracts, and developed a SMART goal that encompasses the metrics in their contracts that would help feed into a reduction of child maltreatment in a specific area surrounding?
I think you're on to something with that on multiple angles. I'll give you that. What are the other folks thoughts on that?
Yeah, I agree. I think that's a good approach. And then come back and we can flush it out a little more.
Would it be helpful if we revise the goal instead of saying in target zip codes to name it cases to reduce the rate and verified child abuse and neglect cases in those areas serviced by FRCs? No, and it needs to be wordsmith. You can't launch a FRC on day one and expect this rate to go down in 30 days.
Right.
Right.
So it needs some cushion about what realistically, what that lag is between starting the FRC and when this could be achieved. That was point one. The other one is when you've got verified, and this is more directed, I think, at your day job, Chair Watts, when you're looking at verified child and abuse and neglect cases, is there a correlation over there to then children whose parental rights have been terminated and then they're in the system and serviced by, in our area, Northwest Florida Health?
Yes, very high level response to that. There's definitely different pathways and avenues, but just know that if here, because here's the deal, something may be verified, it doesn't automatically mean that case will find its way in a judicial posture, but there may be some type of crisis intervention service or someone that's being funded or whatnot that is providing, and it wouldn't be uncommon where a provider may be wrapped around a family, but there may be the need for other resources to come along as well, from a collective point. So there's still an avenue for programming as identified as a particular gap, because there are some gaps. So to that point.
Have we made investments? I thought we had in safe families.
So Safe Families for Florida has been funded once. It was a little new, so they ended up withdrawing their funding. They were funded for some sort of coordinator. And they weren't able to quite keep up with the reporting requirements and all of that. Not to say that there could not be another opportunity for that, but of course, as we are funding programs, it's imperative that they keep up with all of the accountability measures that we've put in to be able to know if the program is working. And I just think they're very hands on the ground. And so it just wasn't a good fit at that time.
So this is all helpful. This is all great. I think we landed on you guys are gonna come back with something else as a proposed draft of this. But what I wanted to just clarify is, do you have to do that now and we need to adopt one, or is this something?
I think we can do that and send it out. I don't know
Okay.
I don't think it'll require another meeting. If we can, if we feel good about letting us draft something else in this space and then keeping the food insecurity one, which was the last one, if we keep those two under family well-being, we can send all of that out and you'll have a chance to look at it with that information and just answer right back to Holly and myself. Then we can compile that and get that back out to you. Long as you don't answer to each other, you're fine.
And Chair Watts,
Yes.
yeah, I agree with Mr. Johnson too on this child abuse and neglect. Oh Lord, I'm sorry. I thought I had my phone on silent. I'm sorry. Let me call
We
you back
didn't
up.
hear it. Oh,
All right, let me turn it off. I'm sorry. I guess following up on what Holly said, that every Children's Service Council in the state of Florida tracks this information or has some type draft goal in this area of child abuse, child neglect. So I think if we make it specific, if we are measuring what we're doing at our family resource centers, like Councilmember Johnson indicated, then I think we're not setting ourselves up for failure. Then we have a measurement tool to see what the FRCs are doing in those areas rather than saying, in targeted zip codes. I think we would take that targeted zip codes out. So yeah, I agree with moving forward. I wouldn't want us to be derelict, contrary to what other CFCs are doing, and we know that this is detrimental and very important for our children and families as well. That abuse, we've seen abuse at its highest here in Leon County this last year, where actual children lost their lives. So I'd like to keep it in, just modify it, right?
And thank you, Chair. Thank you, Council Member Cummings and Holly. My last point on this one, I think we are concluding. The other CSCs, are they using the verbiage rate of verified? That was my first, not a trick question to put you on the spot. Because I also, when you're looking at that, just know that we're also in a space where we're even trying to find those resources, get those interventions to where they're not even coming to a case, not even getting into the door of DCF. Do you get what I'm saying? So even if the wording needs to be more around that, and our assessment is like, okay, so if we have the FRC in the one area, we can likely get information around the types of cases, perhaps. But maybe the assessment is like, this is because this doesn't exist, and our efforts go to, okay, just throwing that out there. We may even change the, okay.
Most of them do say rate of verified, just so that you know, in terms of the work that they do, because the evidence-based programs that they're funding are really focused on the prevention, right? So that their outcome, their goal is really they want to prevent it, right? But how they're measuring that is by looking at, of the programs that they serve, how many of the families have verified child abuse and neglect. That's a huge investment in the prevention space. Many of them, this is where like home visiting was like a huge thing that had kind of erupted, in most FRCs, or excuse me, most CSCs have made significant investments in those spaces. Our need here is that it got funded because a CSC didn't exist, and so how else can we kind of bolster? So we want to be careful about what we're funding to not replicate other things that are there. But that's a big area that they're funding in. But most of them do use that terminology about around verified child abuse and neglect.
Okay. Anything else from the members, the team, before I go to the next agenda item? All right.
All right, so I think we're clear on where we want to be. All right, so this last one is capacity building exploration. So as you know, we've done investments in capacity building, and from our needs assessment, what we discovered is that with almost 2,000 organizations that are serving children, youth, and families in Leon County, as we were moving in a space of more accountability, more fidelity to models, all of the things, we didn't necessarily have that many that were looking at research supported and evidence-based programs, number one, and number two, that really understood the impact that they could have if in fact they were working on their capacity. So, and if I may, last thing is when we did our strategic planning with Alice Lee Stansbury, she was very complimentary of us and was hoping that we would continue down the path of this capacity building so that we end up with providers who are very well versed on what they need to do, not only as far as servicing, but also how do they memorialize and document what they're doing to show that they're making a difference. So the goal that we developed here, draft goal, is build a stronger, more coordinated system of care. I think Mr. Johnson will like this. In Leon County, by improving the capacity and effectiveness of child and family serving organizations by 2030. So We'd have to develop this through a baseline assessment of partner capacity, coordination, organizational health, followed by annual measurements of improvements. I could see us partnering not only with the city and the county, which we already have, but also with UPHS. I will go further by saying one of the visions that I have is creating a Leon County conception to career continuum and really looking at where all of our providers, whether we fund them or not, fit into that continuum so that we can really see, again, where gaps are and where we need to be putting funding, and not only just us, but it can also help inform what other funding these organizations should be seeking so that we create a true continuum from conception to career. So when we're looking at the objectives, we're establishing a baseline and a measurement framework, strengthening the organizational proficiency through training and certification, improving data quality and shared accountability, and strengthening organizational sustainability and CSC Leon's internal capacity. So as we said on the agenda, this is more about the exploration piece of this. And Mr. Johnson, Mr. Watts, at your approval, I definitely would like Councilmember Johnson to talk about his vision for how we look at what's going on in the entire county. While we tried to do that, and I think we initially did do that with the needs assessment, we are now almost, I'm getting ready to start my 5th year. The needs assessment really looked at 2021, was published in 22. So we're at a point where we need to look at that again, do some sort of update, but in my estimation, take it even a little bit further. We started with a kindergarten roadmap, and I think the kindergarten roadmap was a good start, but I don't think that's going far enough. I think that's kind of short-sighted, although there will be people that say everything we do should be in that space. I do think that we have to have someone in our community, some organization that really convenes this conception to career. And I think we have all the pieces. We just haven't figured out how to put it all together yet. So with that, I'll turn it over to Mr. Watts or Mr. Johnson to talk through what your thoughts are about it.
Sure, go ahead, Mr. Johnson.
I need a little help framing.
I put you on the spot.
Well, and I don't mind being put on the spot. Are we talking about specifically here in capacity building, or just generally the data that we collect as CSC?
I think it's a little bit of both. So we've got, I think, enough data to know that capacity for our organizations here is challenging. And it's just the nature of the continuum of funding and how things are funded and the funding organizations in our community. So when we came along, we really requested a lot of accountability, and that threw a lot of our organizations into a bit of a tizzy. I'll quote Kelly Oddie from Oasis, who says that CSC by far requires more accountability, more documentation, more everything than any of her other funders. So if we want to continue in that space, we have to be able to educate and empower our providers to understand that if they want to be in a space where they are working with CSC Leon, there are things that we're going to require. And it's not just about us, it is about ensuring that the whole county understands where we want to be as far as a county. I think the work with the Summit on Children, and so Mayor Gillum kind of started this when we're talking about the investments in the early part, so that as Superintendent Hannah says, that conception to age 5, but really as a council, we adopted kind of this conception to 24, 364 days. So has anyone ever mapped what that looks like? And then where everybody fits. And then as a community, we have this mission and vision, and everything that we do as providers, irrespective of where you're getting your funding, not only feeds into your mission as an organization, but feeds into the mission of this community for our children, youth, and families. Did I confuse things?
Mr. Watts, can I just say this very briefly? It's real general as well.
Yes.
I like this particular draft SMART goal, specifically in line with the realignment of the CHSP that the county approved Tuesday night. I think it's important that we equip our service providers. So I was looking at all the objectives and what have you, and I think it's important, and I thank Sika and her staff for looking at this, but I think it's vitally important right now. We don't want to stymie service to our children. And I think with that realignment is what they've indicated, 14 new nonprofits that they have dropped off of CHSP, sending them to the Children's Services Council to respond to the request for proposals. But of course, it's a backup plan that if they're not funded, then they can go back to CHSP. Many of those have been successful in receiving contracts through CSC, but some haven't. So I think, in the long range, in the short range, I think this capacity building is almost imperative.
Thank you, Councilmember Cummings. Did you have something else, Mr. Johnson? You.
I would just add that I agree that it's critical for our community. I don't know that it's the role of the CSC to do it, but it's the role as the CSC as a catalyst or convener to make sure that it's being done. In fact, I thought that was one of the objectives of UPHS was to build that capacity in those providers. My experience since I've been on the council is we've made 2 investments in some of those smaller providers that we've spent an extensive amount of council time trying to recover the money. And it takes our focus away from some of the other areas. So I do think it's vitally important and agree with Councilmember Cummings. I just pause about whether it's the role of the CSC to make investments in that area, given the other SMART goals that we've got going on.
I appreciate that. And so my point of view is I don't know that it needs to be a SMART goal. We already engaged in this, correct? Or did we put a pause on it?
We engage in it. Right now, we're doing it mostly in conjunction with our procurements. But we also have some capacity building that is done through our partnership and membership with Florida After School. So when we're looking at our out of school time programs, there's professional development and best practices that is available through our membership with them. They each could get those accounts. Of course, we have SIPs. And if you remember, SIPs was so that smaller entities could start the process of understanding what applying for grants is, accountability, and then we went to SIPs 2.0 so that those that successfully did SIPs 1 could now do SIPs 2 and then be ready to apply for larger procurements, whether it's with us or with somebody else. So while I hear what Councilmember Johnson is saying, there is a role that we play, but we don't play in that role by ourselves. As with anything else we do, there's a role we play, but we don't play in it, by ourselves. So I think it's about creating a goal that allows us to have our part in that while working with our other collaborators to ensure that we're all moving in the same space. So I think we're actually already kind of started to do this. We just don't have a goal around it such that we as the team or as the council is accountable to the community for what we're trying to accomplish.
Thank you, Sika. Question. Is this one of the subjects, the headers that we actually need a draft goal on? No.
Ye-
Bam.
Yeah, I think we need one. And it's just one. It's just kind of that last little piece. So our areas that we fund are kindergarten readiness, youth success, family well-being, and capacity building. So program
Oh,
support.
capacity building is one.
So I think if
Okay.
we just had one,
Okay.
um, it would just keep us on track and keep us accountable to the community for what we're doing. And not only the community, to the provider community, our community investment partners, for what we're doing to help ensure that we are helping them prepare to apply. And again, we emphasize, yes, there's our funding, but our expectation is that as you get better, you are looking for other funding mechanisms. And I'll use FRC as a perfect example. We are not going to be able to continue to fund all of those FRCs at the amount that they are being funded. So that is why their sustainability is important. They're a larger group. They know how to do that. Somebody like I'll use Carter's Corner, who is doing well. He is now learning about all the different kinds of money that is available to couple with what we're doing. So I really think we should have at least one goal under capacity building.
All right. In Carter, I'm sorry.
Carter's
But
Corner, 24
they
hour,
were
they
one
go
of the
straight to 24/7 dads.
they were one of the participants in this when we did this before, right? The capacity
So
building?
he
No.
he was
Okay.
he was able to go straight into family supports. But it was because he participated in all of our stuff. I think Dursey is probably one of the best examples of participating in our capacity building, really not doing well that first application, and now they are one of our top performers. And he is now in the process of looking at other funding mechanisms to help with that. So I think that's one of the best examples we have with this capacity building space.
Any other thoughts? Do we move forward with this as a SMART goal?
Mr. Chair, I think that this is important because it gets to the heart of those entities that are providing services for our children. And I do know that UPHS, Executive Director Gordon, they are trying to, strengthen all the members, the nonprofits, and it's a lot of nonprofits, a lot of membership in that UPHS has. But I think it's important that we have this objective and this goal to strengthen those, to help build capacity of those entities that provide the services. Because without that, it's going to fall down to deficiency as far as providing services for our children. So I think at some level, we do need to have this capacity building. And I think our executive director and Holly and those, for the objectives that we have here, I think we can modify them or what have you, but I would not want to just alleviate this particular goal at all. Because it goes to the heart of our mission with our service providers.
All right.
The last thing I'll say is that other CSCs do invest in capacity building. In some cases, I think it's Miami, the Children's Trust, they have created an entire capacity building arm. Now, granted, $152 million a year. But they've created a whole arm because they don't have a UPHS in their community with whom to partner. We have some partners in our community, city, county, UPHS, United Way, that we can come together, Florida After School, that we can come together for this capacity building space. But I do feel strongly we need one goal. I don't think we need several. I think one gets us where we need to be.
All right. I think we are at a space because here are next steps. Ultimately, this team's work to come up, narrow down some proposals to bring to the larger group. So even if some are not 100% attached, let's say to capacity building, again, it's our effort to bring something to the larger group because we're still going to have to vote on it and we can share, our points of view. So I think we're good, in my opinion, to move forward. You guys are going to bring back to us the family well-being revamp.
So
And go ahead.
So we will compile everything that has been developed to this point. We will distribute that to each of you for your review. We will get with, I think we've got some work to do with the school board. We've got some other things we're going to investigate so that we can refine our objectives and tactics. And remember, the ad hoc committee was put together to create these goals to make it easier for a discussion point for the council for us to finalize. So don't feel like you have to have the absolute final goal, but this makes it easier for the entire council to digest what it is we are trying to accomplish. So we will work to get that to you in the next week for you to review at your leisure and get back to us by the end of the year. And we will finalize that so that we're ready for presentation at the January 15th meeting.
I appreciate that. Our next agenda item was a next meeting date, but we're gonna put a pause in that. I don't think that we need that. Nor a next meeting agenda. And do we have any work group member comments?
No, just seeking, Holly. I'll follow up with you guys. Hopefully we can get together next week sometime and I'll pull a group together and
Absolutely.
day and time. Okay.
Yeah, it's a great meeting, Mr. Chair, and I just want to thank you and Holly and Seeker and staff. And of course, the superintendent is just very invaluable in most of what we do from a statistical baseline standpoint. So I certainly appreciate Superintendent Hannah. And I wish everybody Merry Christmas, but we'll see everybody on the 18th, right? We
Yes.
meet on. Okay, awesome. Thank you.
All right.
You said.
Awesome. I have some good news. After 5 or 6 years now, I will finally be graduating tomorrow from FSU with a Master in Business Administration. It has been a long haul. I will walk tomorrow at 2 o'clock and then start figuring out the next bad idea. So with that,
Congratulations.
I can't do a reaction. Congratulations, Vice Chair Watts. That is awesome. And we look forward to celebrating you at our council meeting, which for anyone that's watching, council meeting is at 4 o'clock on December 18th at CSC Leon's office.
Dr. Watts does sound good though.
It does sound good.
Oh, did he say master's or doctorate? Is it doctorate?
Master's. He's getting his master's in
I
business
think that
administration.
Superintendent Hannah just told him to go back to school.
Oh, okay. Is that what that was? Okay.
No, I'm like you, Terrence. After my master's, I was done. That's all I needed. I had writer's fatigue. I was done writing. There was no such thing as AI, so I was having to come up with it all on my own.
Okay, we are still broadcasting. How about we go ahead and adjourn the meeting, Chair?
a meeting adjourned. Thank you.
So much.
All
Have a
right.
good weekend.
Thanks, everybody. Appreciate you guys.
Thank you.